Hello, I'm Mary Beth Best, an advocate with Voice Incorporated, a nonprofit organization helping people better understand their Medicare benefits. When making a decision about your Medicare coverage, it's important that you understand your options, and there are lots of options. Medicare itself is a government entitlement program for individuals that are eligible by disability, as a working person that's become disabled permanently, or by age, someone that's turned 65 years old. There is one Medicare program, however, there are two specific ways that you can elect to receive your benefits. One is through the traditional format of Medicare, and the other is through Medicare Advantage plans. And what I'm going to do is I'm going to take you through a checklist of what Medicare is and what Medicare is not, and what Medicare Advantage is and is not. Now, under the traditional format of Medicare, Medicare is a Social Security program. It is a fee-for-service program, and that means that your services are paid for as you need them through the Medicare system. It is managed by federal contracts directly through the federal government and accepted at any place that a doctor accepts assignment. And that means that they agree to accept the reimbursement rate that Medicare offers. Now, if you have a doctor that is non-assignment, they still can only charge 15% above that reasonable reimbursement rate. Medicare is not 100% coverage, and that's important to remember that Medicare does cover the majority of your health care at 80% for most services, and sometimes 100% for those things that are medically necessary. Medicare by itself does not cover prescriptions, except for those that would be administered by a doctor in the hospital, such as an IV. So with using the traditional format of Medicare, you would also probably carry something extra. You may have a state Medicaid program. That would be through Tennessee, our TennCare programs. You may have a private company that offers supplementation to your Medicare. You may be a retired person that has a retirement benefit, or you could be a veteran, someone that has military benefits, and all of these things would complement your traditional Medicare. In addition to that, you would have some sort of prescription benefit that you would have to choose if it was not included in some of these other benefits like your retirement or military. And that would cover from head to toe all of your medical needs. Now, that is one format that you can get Medicare. The other is the Medicare Advantage. Now, Medicare Advantage is a Medicare health plan. It is not managed through direct federal contracts. It's managed through private companies. These private insurance companies receive monies from the Medicare program to create, develop, and manage your health care through Medicare. Medicare Advantage is provided through these private companies. It is comprehensive. That's important to know. In opposition to the original format of Medicare, where you would have additional benefits such as private or retirement plans, a Medicare Advantage plan would stand alone. Now, your state Medicaid programs would coordinate with a Medicare Advantage, but other than that, everything is included, including your prescription benefits. Medicare Advantage plans do require that you use a certain network of providers. That's extremely important, that you are able to work within the range of doctors in your area. Medicare Advantage plans can come in the form of an HMO, a PPO, or private fee-for-service or special needs plans. And all of these are very different and operate differently. It's important you understand those before you make a choice. Medicare Advantage plans are not supplements. That's really important. That's often a mistake that I see people make, that they kind of clump those things together and consider them all supplements. They're not. They're actually separate individual plans. And as a matter of fact, a Medicare supplement does not coordinate with a Medicare Advantage. The only thing that would coordinate with Medicare Advantage would be your state Medicaid as well as military benefits. TRICARE for Life, for instance, would coordinate with a Medicare Advantage. Medicare Advantage plans cannot be used with a Medigap Medicare supplement. That's very important to remember. Medicare Advantage plans, although they are through private companies, they must cover at a minimum everything that Medicare Original covers. However, they can offer incentives for your enrollment with extra benefits like YMCA membership or something like that. But be very careful with these extra benefits and incentives and make sure that they outweigh the other options with the Medicare health plans. More importantly to you is that you get the care that you need through the providers of your choice, those providers that you feel that you trust and can depend on. So make sure that your health insurance matches your health care needs. Remember, it's important to understand these options. Please seek out help through 1-800-MEDICARE or by calling Voice or a local counselor, or even just asking a friend, someone that's had this experience. I'm Mary Beth Best, an advocate with Voice Incorporated. Thank you.